Hey folks, it's Dr. Gersmar from Aspire Natural Health. I wanted to take a moment to talk about some of the testing that we do. In particular, we're going to talk about Genova's GI Effects stool kit today. So it is one of the more common tests that we use to look at digestive function, any issues that are going on with the digestive tract. So it is a stool kit, or let's be frank, a poop kit where you're collecting some poop. I know the test can be a bit confusing, so I wanted to take a minute to go through it, clear up any questions that you might have. So first and foremost, you can see it is the long box. We'll have right now the orange label, at least, the GI Effects on it. Outside, we're going to have a sleeve with the form. So this is an important form for you to fill out, to have been filled out. So we open this form up. See, right now the front side looks like this. So if you've been in the office, and I've done it, you should see my signature across the top. If we've sent you this kit, the signature may not be there. If we've sent it to you, it's fine. The signature doesn't need to be there. Genova knows that we've sent the kit to you. They don't require that signature. But if you've been in the office, we'll have signed it. You'll have clicked off here, or we will have the payment form, and so if you're doing Easy Pay with Genova, that'll be selected. Otherwise, no insurance billing and the cash price there. All right, there'll be we have another video on Easy Pay, so if you need to review that, please do so. We should have checked. If you're doing Easy Pay, you'll need to have some of the diagnoses code checked, and we'll have either done that or asked or sent you that information. All right. Almost always we're doing the GI kits, the GI Effects comprehensive profile, so that should be checked off as well. And the last thing that will need to be done, that you will need to fill out, is the date and time that you collected the sample. So for most of you, what it'll look like is I'll have signed it, I'll have checked off the payment option, any codes that we needed, as well as the comprehensive designation. The only thing that you will need to check off will be the date and time that you collected the test. Again, if we've sent it to you, we haven't signed the top, then just make sure that the correct payment information has been checked off, make sure comprehensive is checked off, and fill in the date and time. All right, we turn it around to the back. It looks like a lot, but it actually is pretty straightforward. Up at the top, you'll put in your personal information. Here's your insurance information. If you're doing the Easy Pay, you will need to have that included. If you're doing a cash-only pay, where you're paying the full cost of the test, you do not need to fill out this part. Okay, you will need that include your payment information, so credit card, check, HSA card, similar thing, sign the bottom. So once again, fill out your personal information. If you're doing Easy Pay, fill out the insurance information, your payment, and your signature at the bottom. And that is this form. So front and back, please make sure that it is filled out so the company can process your test and they know who it belongs to. Once you've filled it out, you can slide it right on back into the plastic holder. All right, so opening up this test kit, we can look inside. So we see it looks pretty much like this. We have a warning, please don't overfill the vials included. That's gross and messy for everyone. We have a little check off, the things that you need to do for this test. We'll see that there is a patient questionnaire that the company asks you to go ahead and fill out so they can gather some information and know what's going on. Now, as far as what's going on inside, we have a big clear plastic vial. We have a bag and kit here. So on the outside pocket, we have the instructions for the test. We're going to go over them in brief, but please double check and go over them before you collect the test. So on the front, we have a list of everything that should be included in the test. Worth a quick double check, make sure nothing got left out. Very rarely, but occasionally happens. We go to the inside. Now, you can read the patient preparation. I'm going to go through the one most important point that gets a lot of questions. So they say this: if you're taking any antibiotics, antiparasitics, antifungals, probiotics, or food that has probiotics, like fermented foods, they ask that you wait a minimum of 14 days after your last dose before taking the test. Now here's the deal. If you've had a visit with me, I should have informed you on this. If I've somehow it's not happened, what we say is that if you've been taking those things for a decent period of time, meaning weeks to months, then we'll have you just go ahead and continue taking them. There's no need to stop. There's no need to wait 14 days. If Excuse me, if you've just started taking those things, then we do ask that you go ahead and stop them. Here's our rationale. If you've been taking them for a while, your digestive system has adjusted to having those things in it, and we'll see that reflected in the test. We'll adjust for those things as well. If you've just recently started taking them, then we do ask that you stop because things will be in flux and we won't be able to get an accurate reading. Okay, so that is one of the most important things. Then just to answer the question that everyone asks, how do I collect the sample? So if you look inside the bag, we have this nice tray here, and simply put, honestly folks, you're just going to take everything out of the tray, you're going to sit down on the toilet, and you're going to collect some poop right in the tray. I know, kind of gross, but it is what it is right now. We do have gloves that are included, so for obvious reasons, we recommend you glove up before you collect the sample and while you're processing it, all right? Then you're essentially just going to go ahead and transfer. We've got 3 tubes for you to use. You're going to go ahead and transfer some poop from your handy-dandy tray into the vials. Again, being careful not to overfill. The other most important point is we really do need you to label each of the vials. Okay, so you're going to poop into the tray using the gloves and the little spatula that they've got here. Transfer from the stool here in the tray into the vials. Write the name, have written your names and everything, your name on the vials. Close them up nice and tight. We're going to go ahead and put them in the bag. Actually, my apologies, folks. We actually have one other bottle as well. So 3 that came right here, a 4th one here. So that's going to all be included. You're going to collect them all in the vials, close them up nice and tight. Again, all of them are labeled. Go ahead and put them into the bag, seal it up nice and tight so everything is taken care of. Now, the tray, once you're done with it, you can either just simply throw it away, you can put it in the bag and throw it away. To me, it's a bit of overkill, but they have it included for you. And then the next piece. So you've collected your sample now. Now we need to get it off to the lab. You have 2 choices. You can take it to a FedEx location, one of their drop boxes or one of their locations, and drop it off there if you want to do it. Or you can call FedEx. They will come to your house or your work. They'll pick it up. They do not ask what it is, so you don't have to feel embarrassed or worried about that. They do not charge you anything, so basically you're going to follow the instructions that are given here. They have a number and an account number. You'll call the number, you'll give them the account number, you'll tell them the location for pickup, and that's basically it. Then FedEx will zoom on by and they'll pick it up from you. Again, no questions asked, so please don't feel embarrassed. Lastly, the bag is here. So, assuming you're having come and pick it up, you've collected everything, you've labeled everything, you've put it in the bags, then you put the bag with all these containers into the box, close up the box, put the box into the FedEx bag, and attach the sticker to the bag. All right, you call FedEx, you just hand over everything to them, they take it away, and you're good to go. The processing time currently is about 2.5 to 3 weeks on this kit, so we do recommend that you get it done as quickly as possible. All right, I hope that's answered some of the common questions that people have about the kit, what's in the kit, how to collect the samples, and any other information. All right, if there are any other questions that you have, you're not sure what to do, you need some help on it, please feel free, give us a call. Lorelei is here. You can call us at 425-202-7849 or drop her an email. All right, and if you're not quite sure about Genova's Easy Pay program, please check out the video entitled Understanding Easy Pay, where I go over it in more depth. All right, folks, the Genova GI Effects test or similar stool tests, which are all quite similar to this, are incredibly helpful in understanding what is going on with your digestion. We highly recommend it. We understand it's a little bit of grossness, but getting it done is a really big deal. You'll be glad you did it. Lots of great information. All right, any questions? Let us know. Until next time, folks, take care.